Welcome to The Explainer. Today, we are diving deep into some really critical pathological breathing patterns. What can a simple breath actually tell you about what's going on inside a patient's body? Turns out, a whole lot. Let's get into it.
Right. So a patient's breathing, it is so much more than just air moving in and out. It is a massive diagnostic clue. The rhythm, the depth, even the pauses or lack of them can tell you about everything from heart failure to a serious brain injury. So let's break down what you need to be looking for.
Okay, first up, we're going to tackle the most intricate pattern of the bunch. And there's a good reason for that. If you can really get your head around the mechanism behind this one, all the others will just click into place.
So the single most important thing to get here is that this is not random at all. It's actually a super predictable repeating cycle. The body overbreathes, then it stops, then it overbreathes again, all in this regular, almost rhythmic pattern.
So what is actually happening here? Well, it's all about this unstable, kind of wonky feedback loop. Imagine your blood CO2 starts to rise, which is the signal to breathe. But because of something like slow circulation, that signal gets to your brain late. By the time the brain gets the memo, it kind of panics and overreacts, making you hyperventilate. This blows off way too much CO2, which then tells the brain, whoa, stop breathing entirely. And then the whole cycle just starts right over again.
And this quote just nails it, right? It's like a faulty thermostat in an old house that has a huge delay. It gets too cold, so it cranks the heat, but it way overshoots the target and makes it boiling hot. Then it shuts off, undershoots, and gets freezing cold again. That constant back and forth, that oscillation, is exactly what's happening with the body's breathing control here. So this very specific kind of elegant rhythm, this is what we call Cheyne-Stokes breathing. The breaths get deeper and faster, then they get shallower and slower, and then they just fade away into a period of no breathing. That's the apnea. It waxes and wanes just like a wave before the whole thing repeats. You're going to see this most often in conditions that slow down the body's circulation, and congestive heart failure is the classic example. That increased circulation time is the whole key. It's what creates that signal delay to the brain we just talked about. Stroke and central sleep apnea are also really common culprits.
All right, so now that we've got a handle on that regular, cyclical nature of Cheyne-Stokes, let's check out two very different patterns that are pretty much defined by their lack of that kind of rhythm.
So, on one hand, we've got Kussmaul breathing, which is just relentlessly deep and continuous. And on the complete other end of the spectrum, we have Biot's respiration, which is just pure chaos. The contrast between these two, and with Cheyne-Stokes, is pretty striking.
Now with Kussmaul breathing, the brain isn't malfunctioning. Actually, it's driving this deep, rapid breathing on purpose. The body has become dangerously acidic. You see this with things like diabetic ketoacidosis. And this breathing pattern is a desperate attempt to fix that imbalance by blowing off as much CO2 as physically possible. And notice the key feature. There are no pauses. It is absolutely continuous.
Okay, now this pattern is pure chaos. It's sometimes called ataxic breathing. There is no rhythm, no predictability, just totally irregular breaths of different depths mixed in with random periods of apnea. This isn't the body trying to compensate for anything. This is a huge red flag that the central controller of breathing itself, the medulla in the brainstem, has been severely damaged. Okay, let's bring all three of these patterns into focus with a direct side-by-side comparison. This is really where it's all going to click into place.
All right, this slide is the payoff. Just look at the rhythm row. Cheyne-Stokes has those regular cycles. Kussmaul's is also regular, but in a deep, continuous kind of way. And Biot's, it's completely irregular. Now look at apnea, those pauses. It's there and it's cyclical in Cheyne-Stokes. It's totally absent in Kussmaul, and it's present but completely random in Biot's. And finally, the cause tells the whole story. A feedback delay for Cheyne-Stokes, a metabolic problem for Kussmaul, and direct brainstem damage for Biot's. See? Each pattern is telling you a very, very different story.
So how do you lock all this information in your brain for when it really matters? Well, a few simple tricks can make all the difference.
Here are a few easy mnemonics. For Cheyne-Stokes, just remember the word cycle. Its defining feature is that predictable, repeating cycle. For Kussmaul, think K for ketoacidosis, which is its classic cause. And for Biot's, think brain damage, which leads to that bad, chaotic breathing. Simple as that. Recognizing these patterns is such a critical first step.
It really transforms a simple observation into a powerful diagnostic insight, and it guides what you're going to ask and what you're going to do next. The body is always communicating with us, and learning to read its rhythms is how we really start to understand what it's trying to say.